Impact of an integrated yoga therapy protocol on insulin resistance and glycemic control in patients with type 2 diabetes mellitus. This was printed in the Rambam Maimonides Medical Journal and printed in the National Library of Medicine, National Institute of Health. Abstract objective: diabetes mellitus, characterized by chronic hyperglycemia, is attributed to relative insulin deficiency or resistance, or both. Studies have shown that yoga can modulate parameters of insulin resistance, and the present study explored the possible beneficial effects of integrated yoga therapy with reference to glycemic control and insulin resistance in individuals with diabetes maintained on standard oral medical care with yoga therapy compared to those on standard oral medical care alone. Methods. In the study, the subjects on yoga intervention comprised 35 type 2 diabetics, and an equal number of volunteers constituted the control group. Subjects ranged in age from 30 to 70 years with hemoglobin A1C tests more than 7%, and were maintained on a diabetic diet and oral hypoglycemic agents. Blood samples were drawn prior to and after 100 days of integrated yoga therapy intervention. Fasting blood glucose, postprandial blood glucose, HbA1c, insulin, and lipid profile were assessed in both the intervention and control groups. Results. The intervention group revealed significant improvements in body mass index in their homeostatic model assessment for insulin resistance and very low density lipoprotein levels. Increases in high density lipoprotein after 100 days, 20 days were not significant. However, when compared to changes observed in patients in the control group, all these improvements proved to be significant. Conclusion: administration of integrated yoga therapy to individuals with diabetes leads to a significant improvement in glycemic control, insulin resistance, and key biochemical parameters. Introduction. Diabetes mellitus is a leading cause of mortality worldwide. As per 2019 estimates, 77 million individuals had diabetes in India. The figures are expected to touch a staggering 134 million by the year 2045. Yoga has its roots firmly entrenched in India and evolved over the last 4,000 years as a traditional form of mind-body training. Yoga asanas, the typical postures, and pranayama breath control have recently become very popular, and the role of yoga in several chronic diseases has become the topic of current interest. A host of evidence-based trials have shown that yoga can pronouncedly attenuate fasting blood glucose and improve glycemic control, besides improving the lipid levels and quality of life in diabetic patients. Mind-body practices essentially depend on the ability of the mind to enhance physical health and vice versa. In recent years, the practice of yoga as a viable non-invasive approach has been steadily rising thanks to evidence-based reports. It must be stressed that yoga is generally safe and simple to learn and can be practiced by individuals who are interested in yoga learning. Furthermore, yoga paves the way for novel strategies to combat stress, reduce anxiety, and enhance positive emotions. Several earlier findings indicate that yoga practices may lead to pronounced improvements in management. The significance of non-drug lifestyle modification could hold the all-important and decisive key to diabetic management. In this context, there is a need to educate patients and their families on the benefits of evidence-based yoga therapy. The main objective of the study was to evaluate the added value of an integrated yoga therapy protocol and improve fasting blood glucose, postprandial blood glucose, hemoglobin, insulin, and lipid profile in type 2 diabetic patients treated with oral hypoglycemics. Methods. The study was carried out over 2 years by the Department of Biochemistry, the Diabetic Outpatient Clinic, and the Yoga Therapy Center of Mahatma Gandhi Medical College and Research Institute in Puducherry, India, a tertiary care teaching hospital. The study was approved by the Institutional Research Advisory Committee and the Institutional Ethics Committee. All subjects recruited to the study signed an informed consent. An earlier study had revealed that the practice of Raja Yoga meditation could lower serum cholesterol, and the beneficial effects of yoga in alleviating dyslipidemia has been investigated. The beneficial effects of yoga as observed in this study are promising, and hence in the long term would provide proper control of blood sugar and stabilize lipid profile level. However, for various reasons, individuals with diabetes often cannot sustain the levels of recommended physical activity, and hence there is an inherent issue with compliance. We do believe that the stretching of the body during yoga asanas could rejuvenate the islet cells, these increasing insulin secretion and hence correcting the impaired insulin secretion in chronic diabetes. However, we emphatically state that the protocol developed by us needs to be further taken up for future studies in a comprehensive manner to evaluate short and long-term benefits of yoga on diabetes. It's believed that the conglomerate of psychoneuroendocrine and immune mechanisms has holistic effects on diabetes control. Earlier studies had revealed that parasympathetic activation and the associated anti-stress mechanisms could help improve overall metabolic and psychological profiles. Besides enhancing insulin sensitivity and improving glucose tolerance and lipid metabolism, we do believe that yoga therapy reduces blood glucose levels by enhancing insulin sensitivity and helps in the management of comorbid disease conditions associated with diabetes, thereby resulting in significantly improved clinical outcomes. The effect of physical exercise on blood lipid profile has been well documented, and physical activity and HDL appear to be linked through HDL's role in triglyceride metabolism. Further studies are needed to investigate the LDL lowering effect of yoga therapy, and our laboratory is presently pursuing research that includes the effect of yoga therapy in diabetes as evidenced by reliable markers of oxidative stress, anthropometry, and gene polymorphism of angiotensin, since oxidative stress and adiponectin levels are intrinsically linked. We expect to receive the results of this new study in the coming months. Novelty. Prescribed integrated yoga therapy protocol is simple to practice, requires little space, and can be practiced at one's own convenience in the comfort of the home, at least 2 hours after a full meal. As an adjunct non-invasive therapy, it could help people with diabetes to delay the occurrence of the micro and macrovascular complications such as retinopathy, neuropathy, nephropathy, and ischemic heart disease. Conclusion. The results of the present study are encouraging, and it's concluded that integrated yoga therapy as an adjunct and non-invasive therapy is ideal for people with diabetes. The integrated yoga therapy protocol developed at our institute with a mild set of asanas and pranayama techniques could be practiced easily and could have beneficial effects in individuals with diabetes. Limitations. Due to the small sample size, a descriptive analysis was carried out, and age and sex matching were not possible. direct homogeneous assay was not available for performing low-density lipoprotein estimation. Future scope. Yoga therapy is a non-invasive and viable lifestyle modification that may be practiced safely by people with diabetes. Yoga therapy in association with standard rational medication and could effectively delay the complications of diabetes. In the future, the effect of standardized yoga therapy should be considered in the light of gene polymorphisms associated with insulin sensitivity and insulin resistance, which could open newer vistas in personalized medicine. Yoga therapy could thus be considered as an effective therapeutic modality. More studies on yoga intervention in prediabetes with inputs from lifestyle modifications could also open new horizons in non-invasive medicine based on complementary and adjunct yoga therapy.